So we will just start by going into whatever you have into a fold that replicates this. It's probably about a full inch thick. We're just going to navigate together. I know everybody has a different item and different size, different thickness. So we're just going to do it by feel versus having the exact same dimensions and height to everything. But we're first just going to go into our meta restore position, laying this down, and we'll have our pelvis on this to start, which is going to create a lift in our pelvis. And then what you'll notice is, depending on where you put your bolster, your pelvis can sit in a 12 o'clock, in a resting 12 o'clock, or it could be resting more in a 6 o'clock. So notice, like, where is the primary pressure point of your pelvis on this bolster. So initially mine was where my pelvis is more into a 12 o'clock, where it was in a butt tuck and a flat back. So let's pull the bolster up, the blanket, whatever you have, up towards the head so that your pelvis is sitting more in a 6 o'clock. That means the pelvic headlight's pointing more towards the knees. In these positions, there's the art of relaxation, of being able to just sink the body, which we go over in our decompression phase. That's one of the reasons why we repeat it so much in our 7-phase formula, or it's part of our formula, so we could train our body just to instantly release and relax into it. So just notice in your body where you're holding the tension and see how much you can melt into it. So the pelvis is more in that 6 o'clock. Bring your fingertips up to your headlights. Now you're going to press your right fingertips into the right headlight. And then you move over to your left fingertips into your left headlight. And you'll notice some sensations in your body where the right pelvic headlight creates a right pressure in your low back and the sacrum SI joint. Your left pelvic headlight pressure provides pressure in the left SI joint. And now you push together at the same time, and that helps then create a different orientation for the pelvis bones over the sacrum. And notice if that feels good for me and my body. There's a sense of deeper relief when I press the headlights down into the ground with my fingertips. And this is a great way to help relieve some low back discomfort, is by creating this opportunity for the pelvis, the right and left pelvis, to shift over the sacrum. Press into the right headlight once again. With the pelvis being elevated, it changes the vector enough to where there's a shift in the way the pelvis can move when you push on it. Push into the left pelvic headlight towards the ground. These are all palpatory skills from being a bodywork specialist. Now, press the fingertips into both headlights. And then slowly relax. And now just relax your hands to the 45 down and notice how much more melting can occur. And then we're going to slowly slide the blanket or whatever you have up further towards the head. And the goal here is to have the lumbar curve supported in a deep 6 o'clock arch. And then the sacrum is being tractioned down to the ground. So what think about the L5, the lowest lumbar spine vertebra, is allowing the sacrum to traction down towards the ground. So you put the bolster right up against that lowest part of your low back, not on the pelvis or the sacrum, so that we create this fulcrum where the L5 is being stabilized and that sacrum gets to hang and descend from there. And that creates a tractioning feeling. And it changes. So you just slowly tuck the blanket or whatever you have. If you have a block or something, you just put the edge of the block right on your low back, allowing the sacrum. It's like the pelvis is draping over. And then you're bolstering the low back. So the low back is pushing up towards the sky, increasing the curve. This is like the lumbar 6 o'clock in a restful position, in a bolstered position. Those of you who have low back pain because of a flat back, butt tuck, shallow femur, the lower pain pattern, pain cluster, this is really helpful for you all. And it's helpful for anyone else, but especially for those of you whose ligaments and bones are starting to take shape around being in a forward flex position. Because over time, being in those positions too long, under stress and load, can reshape the ligaments in the bone. So once you feel like you're at a pretty good, comfortable space where you feel some release and relief and some traction and some space, we'll go ahead and lengthen the right leg only. Then we dorsiflex the ankle to allow the heel to lengthen. And when you feel that heel lengthen, and then you place the heel back on the ground, it creates this sensation of somebody grabbing your heel and pulling it. It's a subtle traction of the back fascial line all the way up until the lower rib cage, where the quadratus lumborum attaches into the 12th and 11th ribs. But you have to dorsiflex the right ankle, lengthen and push that heel out as far as you can go Then allow the heel to rest in the ground. And then that creates the traction throughout the back line. And that helps open the fascia line. We first worked with the joints at L5 and sacrum. Now we're working with the fascia line, which is a different aspect of the human body, the connective tissue, the wrapping. It's like saran wrap wrapped around our external body and then wrapped around every individual muscle and every individual muscle fiber, around the organs, around the bone, wrapped around the tendons, wrapped around the ligaments. This fascial connective tissue layer wraps around everything, and it has a different way that you lengthen it and create elongation and hydration. And then we add the breath in. We think about the lower balloon breath that's will be introduced in the realign phase course that's almost done on the app. Think about the lower metacenter 1 inch below the navel. Think about the lower metacenter being in the center of the body. The lower balloon breath is just expanding the breath front, back, side to side. It's a three-dimensional expansion breath, similar to the upper metacenter breath, but this is at the lower metacenter. Think about a balloon being blown up. And notice how when you breathe into your low back, that helps with even more traction and even more length of the fascia, lengthening the fascia on the right leg. Lower balloon breath, try not to get the breath into the ribs or at the upper metacenter line. Just keep the breath down at the lower metacenter. And an added benefit is by you pressing into the lower metacenter from your abdominal space or your abs up front. Just go 1 inch below the navel, press into your body just gently. Just a little bit, you'll feel a pulse. This is the main aorta, the blood supply of the whole from upper and lower. There's a Y shape to the vessel into the artery. But when you press gently into this space, it helps reposition your lumbar spine. And it helps encourage the psoas to be further back. It's a gentle press. You're not pressing too hard. It's like 5% of your overall pressure, just gentle pressure, as if you were testing the flexibility of an eggshell. There was an egg on your countertop and you just wanted to test the flexibility of the eggshell. You gently push into that eggshell. The same amount here, you press into your body, the lower metacenter. Slowly release that. Slowly begin to glide the right leg back up to the meta restore position, but let's do it in a way to where the right side still remains lengthened. So the right leg and the right pelvic crest has length now because of the leg being out. Keep that length as you pull the right leg up, but think about the knee elevating to do that. The knee elevates and you slowly glide your right heel along the ground. If you do it too fast, it could shorten the space that we just elongated. So gently just pull that right leg up back to the meta restore position. Maintain the length between the ribs and the pelvis. Now, for some of you, it might start to feel uncomfortable being in this position. Let's see how it feels after we lengthen the left leg. So begin to just dorsiflex the left leg or the left ankle. Keep the right side body elongated and begin to slide the left heel gently along the line of the hip line away from the pelvis, slowly gliding so that allows the joints to open even more. And then we slowly allow that left leg to lengthen all the way. Dorsiflex the left ankle. Feel the weight of the heel. Allow the body to decompress. Once the physical structure, the bones, the fascia, the muscles go through its melting and unwinding, then we'll add in the breath, the lower meta center breathing, or the lower balloon breath, rather. Feeling the breath go into the low back, down at the L5, L4, L3 lumbars, pushing those lumbars into the bolster, the blanket beneath you. And notice how that starts to change the way that your body is feeling, and it changes the sensation of pain or discomfort. Lengthen the left heel even more without shortening the right. Keep the right side long because we worked at that. So as you lengthen the left heel, keep the right length in mind. Returning back to the lower balloon breath. There's 3 balloon breaths. And again, you'll learn more about that in the realigned phase. We've been covering all the regenerate phase breaths. The upper meta center expansion, the mind's eye breath, femur expansion, the clavicle expansion, and the 5 gates. A whole different breath system in the realigned phase. Now breathing into the lower balloon breath that even starts to access some of the pelvic floor. Now let's lengthen the left leg or the right leg as well. So both legs are elongating. Dorsiflexing both ankles. Letting the heel hook into the ground, then to create traction for both legs. You want the pelvis on the ground. So maybe adjust the blanket or the bolster, whatever you got, so your pelvis is on the ground. Go into the lower balloon breath. Try to release the weight of the pelvis to get heavier and heavier. So it rests into the ground with more weight. It sinks into the ground. So yeah, for those of you who have a flat back, you have a forward hinge pattern when you walk or stand, this type of movement is really helpful for you with this mobilization and this bolstered stretch. Because to make the deep changes in a person's body is to reshape the ligament pattern. The ligaments will always pull the body back into the alignment of what they've been stabilizing. So the ligaments are important, they're adaptable, and we can change the way that their integrity is from bone to bone. You can't, it's not a fast thing, it's a slow titration. Same with the bone deformation and the osteoblast formation of the bone. And now slowly begin to glide the right heel back up, but keep the length between the ribs and the pelvis. Glide the left heel up. Feel the weight of the heel on the ground. Keep the dorsiflexion. Feel the heel or feel the knee elevate. So always think about multiple movements happening as the heel glides up, the knee is floating up, and then the low back is lengthening. Let's try that again. Go ahead and lengthen the left heel. As you do that, the left heel is lengthening, the left knee is descending, the left low back is also widening and lengthening. Lengthen the right heel, but make sure the right heel remains heavy. You might need to wear socks if you're not on carpet. If you're on a yoga mat or something, put a blanket underneath your heel so you can glide. The gliding is really important. If you don't have anything, it's okay. Just do a little skip pattern, bouncing pattern. Now we'll get a little bit more length before we do this again. We'll go ahead and bring our arms out to the 45 down, sky palm. Windmill the arms up to the 90. Windmill the arms up to the 45 up. Windmill all the way up to the overhead. Reaching the arms up away from the ribs. The ribs create space from the pelvis. So we're taking the pelvis or rib to pelvis crunch pattern out. Elongating the ribs, elongating and tractioning the vertebra. Now add in the lower balloon breath here. Breathe into the space beneath the navel. More goes into the back. Go into the back first, then go to the front and then the sides. And then slowly begin to relax that engagement. Letting the arms just relax and the legs relax. Internally rotate the legs to set the deep femur, dorsiflex to set the tripod. Notice which heel is weighted more into the ground. Notice which heel feels less heavy. The heel that has more weight into the ground is likely will create a little bit more knee discomfort when you stand and when you move, because the leg is further back inside of the pelvis. So add a little bit of weight to the side that feels less. For me, it's my right leg. My left leg feels heavier. My right leg feels less. Press the side that feels less into the ground. The heel, you're pressing the heel into the ground, but not letting the knee rise. You're not pushing that hard. You're not pushing hard to lift the pelvis. Just enough for the heel. And then slowly relax again and notice if the weight distribution out of your heels feel a little more even. Now begin to gently windmill the arms back to the 90, but always think about the armpit space, the clavicle, the expansion, and the rib lift. As the arms return back to the 45 down, the rib lifts, armpit space is present, clavicle expansion present. Now keep the low back lengthened. Begin to lift we're going to start with our left leg and follow this exact instruction. Go into a slight dorsiflexor on the left. Begin to lift the knee. That requires the left heel to push into the ground. Lifting the knee tractions the femur away from the pelvis and it takes out the left femur hike. There's 3 hikes: femur hike, pelvic crest hike, shoulder hike. This one takes out the femur hike. It creates traction in the left femur to the acetabulum. The left knee elevates a little bit. That pushes the left heel into the ground. Can you feel that? And then it tractions the left femur. Keeping the left low back lengthened, keeping the left femur descended, the left knee guides the movement, the left heel pulls up. When you do this right, it changes everything in your body. Pull it all the way up to the meta restore position. When you pull it up with the heel only, it shortens the low back. We want to keep the low back lengthened. Let's try it on the right. Follow the exact instructions. Now, first, spin the right femur. Now, if we just internally rotate it, it's going to create just a muscle activation. The adductors activate, and you know what that does? It pulls the right femur in towards the acetabulum, creating a crunch from the femur to the inside. Instead, think about the femur, if the femur head up top inside the acetabulum spinning. So the greater trochanter widens to allow the right femur head to drop into the acetabulum. You're using your heel to do that. And that creates a more wide feeling, expansion feeling in the femur. When you just use your adductors to internally rotate, the femur sucks in like a vacuum. But think about spinning, or the term that we came up with in Costa Rica at the retreat is axiate. Stay on the single axis and spin the bone inside of the joint. Now dorsiflex at the ankle. Begin to lift the right knee. As you do that, the right heel sinks into the ground. That tractions the space of the femur to the acetabulum. Feel the length of the low back. Keep the length of the low back. Keep the space in the right femur. Keep the space on the left side. Notice how you're hiking up the left femur. I am right now. So I need to put my thumb there to stop it. Putting my thumb right on the left femur so it doesn't hike up. Now begin to lift the right knee. The right heel gets pulled up. The tractioning of the femur to the acetabulum is present. The low back lengthens. And then we slowly return back to the meta restore position. Let's go into our lower balloon breath. I know some of our bodies are starting to be achy. Mine is a little bit. Let's pull our feet a little closer to our pelvis. Okay, now let's go ahead and start to do the 12 o'clock from the ground expansion. So the pelvis was on the ground and a deep lumbar curve bolstered from the blanket or whatever you have. Push the feet into the ground, and that lifts the pelvis up into the 12 o'clock. Notice how good that feels. Might feel a little crunchy at first. Go all the way up into this elevated 12 o'clock from the ground expansion. Tuning into your kinetic wave. Keep readjusting your head as you gain more distance in your spine, because that's going to help create a neck traction for us, just like with the heel. Now, once we go all the way to the top of our 12 o'clock, just hold it using the feet, not the butt tuck. We got to watch out for you butt tuckers. Try to bring that in every time. No butt tucking, no butt squeezing. Don't flatten the back too much either. And then slowly release the pressure of the feet and allow the pelvis to slowly descend down, thinking of like a rock slide going down the mountain. The pelvis is slowly gliding back to the starting point because the gravity is taking it. Gravity's taking it down. You're not doing anything. You're not using any musculature. We set up the fulcrums so the body can move around a stabilized point to create this sensation. Let's do that again. First, start with the tripod pressure. Then you feel the tripod sinking into the ground, which generates the stack force energy up through the tibia, the femur, going into the pelvis, which then helps lift the pelvis, lifts the pelvis up into our 12 o'clock, disengaging the glutes. Tap on your glutes. Are you squeezing them or we're engaging them? Release that. Let it go. Use the ground. The body comes up into the 12 o'clock. Notice how much length in your spine gets created. Keep lifting up the head, reaching the head up higher and higher as you gain more ground. Add in the lower balloon breath, putting more emphasis in your low back at the L4, L5, staying away from the butt tuck, but just going to a neutral alignment in the pelvis, not going in front of the zero line. Now let's slowly release the pressure of the foot, and the pelvis cascades down towards the ground slowly. You want to do it as a controlled cascade all the way back down to the ground, all the way back down to the ground until you feel the spine resting on the ground. Adjust your feet to what feels good. Feet might move away from the pelvis, move closer. Add a lower balloon breath. We're really focusing on L5 and S1 joint space here. This is where the majority of disc degeneration occurs, the majority of bulging discs or disc herniations or disc problems, the majority of impingements of the nerve. So much happens at this joint because it's the main weight bearing point of the spine. So we're creating space here. Let's do it again. First connecting with the ground at the tripod, 3 points. That creates the stack force energy, which is the bones pushing together. Then the kinetic wave starts to get generated through the bones, through the laser of light lines in the center of the bones, that then generates up to the acetabulum. The pelvis lifts into the 12 o'clock, elevated 12 o'clock. Feeling your headlights point more towards your head. Noticing if your butt's squeezing, let that go. Turtle butt people over squeeze their butt on everything. So you've got to be mindful of that to change that habit, change that pattern. Okay, now locate your pelvic headlights. Now go just beneath the pelvic headlights, you'll find the femur. Just push into the femur, towards the feet, the direction of your feet, through the femur. And slowly begin to cascade the pelvis, a controlled cascade towards the ground. And you're pushing into your femurs with your fingertips, creating a double traction here. Traction, the femur, the pelvis, and then traction at L5 to sacrum. It's a really specific traction. It's really specific movement. You can't get it through straps or contraptions. The double traction. Femur to pelvis, lumbar to sacrum. These are the two components that these two joints control how the pelvis feels. The femur to acetabulum, then L5 to S1. Those are the two main joints that control the pelvis. Now let's add in some of the transverse plane, the rotational plane movement. We're going to do our 3 o'clock, which requires us first to have a heavy pelvis in the ground. Heavy pelvis. Release the pressure on the femur with your fingertips. Allow the pelvis just to rest heavily on the ground. Press through the right tripod. Feel the stack force energy. Keep the weight in your right heel. Don't lift the left pelvis. Allow the left pelvis to go into a deeper 6 o'clock while the right pelvis elevates. Now, it's not going to go all the way up into a 12 o'clock. It's just a little bit of a lift. You just slide your hand underneath your glutes to your ground, you might feel a little bit of space. Now keep the right pelvis elevated in this 3 o'clock. And now go between a 12 and 6 o'clock with the focus of that movement on the left pelvis while the right side is lifted. It'd be better if we had something to hold and stabilize our right pelvis. So if you could slide your hand under there, just a flat hand. So there's a little bit of a tilt in the pelvis. And then we just do this small kinetic wave. Small kinetic wave where the left pelvis sinking to the ground. Right side elevated. We can use the stack force to help lift us, or we can have our right hand there. Or if you got something nearby to slide in there like a book, even better. Now remove the hand, remove the 3 o'clock. Press the tripod. It's going to leave your back feeling a little funny because the asymmetries are being exposed here. So let's equalize it out by pressing the feet down into the ground. The stack force of the bones activates the kinetic wave, moves the pelvis through the kinetic wave, moves through the laser of light lines inside of the bones. All of this is going to be detailed out. In fact, I can put the laser of light line or breath lines video up on the in the Regenerate Roadmap community forum on the current version of the web app. If you don't have that downloaded yet, I highly recommend that. Also, I'll post it on the VIP Facebook group. Now we're here. Feet are pushed down. We're in our 12 o'clock. We're creating symmetry, symmetrical pressures. Now we slowly do a controlled cascade back down to the ground. Slow, controlled cascade all the way back down. Now we get more specific with our rolls. We can traction different segments of the spine. L4, L5, L3, L4, L2, L3, L1, L2. In a similar manner as what we're doing now. Let's go into our 9 o'clock, letting the pelvis be heavy. Press the left foot into the ground. The left headlight elevates. The right pelvis sinks to the ground. The left side comes up. And then we go in between these really small 12 and 6 patterns. 12 o'clock and 6 o'clock. on the right side of that. The idea is to get the right transverse process and the right side of the lumbar, right L5 lumbar and the SI joint moving, just mainly on the right, on the SI joint. The right SI joint only is moving between the 12 o'clock and 6 o'clock. It's really specific. Even if we're not doing it right, we're still making some new movements happen in the body. If you could place your left hand underneath your glute, try that out. Try that out. Okay, now slowly lower the left pelvis all the way back down to the ground. Noticing if you feel like you're getting more weight bearing pressure out of the pelvis into the ground. If you have more weight bearing pressure than before, that's a sign of space. That's a sign of decompression. It's a sign of traction. That's a sign that more space between the L5 and sacrum is being created. Let's go into an equalization. 12 o'clock, the tripod presses into the ground. That reinforces the stack force pattern that's just pushing the bones together. Then the ground pressure, ground expansion creates the kinetic wave that travels through our laser of light lines. Pelvis elevates all the way up into an elevated 12 o'clock. Check in with the glutes for the glute squeezers. Relax them, relax the glutes. Tuning into your headlights, notice which one is higher towards the sky, which one's lower. This is an indicator of if one is further back, that same side could pinch a nerve. So doing all this work is really helpful to release that. Is slow, controlled cascade of the pelvis returning back to the ground. All right, now we're going to slowly make our way out of this movement. We'll do it in steps. First, go back into the elevated 12 o'clock like we were just doing. And then once we get to the very top, we're going to pull the blanket or whatever you have back underneath the pelvis. And if this class just doesn't feel good with what you got today, maybe you could repeat this class with a different item that would help create a better outcome for you. Now slowly slide the blanket or whatever you have down underneath the pelvis, like how we started. Let the body relax, let the body adjust and adapt. Let the body adjust and adapt. Let's bring our awareness to the lower balloon breath. Now, whatever pelvic headlight is more forward, just push that one down with the balloon breath. We'll do a quick, or just a brief pelvic correction here. This is a subtle correction. With the balloon breath, pushing the pelvic headlight down with the side that's higher. Now we're going to slowly pull the blanket out from underneath us to bring our pelvis all the way back down to the ground, preparing us to return back to our natural life without bolsters, without support. Lift the pelvis up a little bit. Hold the body up with the feet. Slide what you have out from underneath you. Returning back to the meta restore position on the ground. Good. Now all this correction, it really requires you to go up into a standing, walking integration movement to help bring it all together. If we go into just a sitting pattern, it won't we won't capture the full essence of it. So just invite everybody to stand up and walk around a little bit. And if you want, we can come back and talk about the class, but it really needs some locomotion, the legs going through the motion of heel strike, mid stance, toe off on both sides to really have this be integrated. So I'm going to go ahead and start that now. Slowly, mindfully. Your milestone position is the back bug. You work towards that. Then we work up to standing. Then we work towards walking. Just take a nice little walk around your room. Get like 10 to 20 steps. And slowly return back to the debrief space. And then we stand for a moment, tuning into our zero line, noticing where we're at, and slowly bring the weight back into the heels. The pelvis returns back to the zero line, going into our lower balloon breath. And now let's hear from our live class folks, how they feel about that class.